welcome to Inner Source Therapy. Today we are going to be talking about PTSD, which is post-traumatic stress disorder. I'm sitting here with Sherry Greenwald. My name is Deborah Ashway Moorfield. This is Christy Esquivel and Lisa Barrow.
How common is PTSD? Well, many Americans have had a trauma, and about 60% of men and 50% of women experience at least one trauma in their lifetime. But only a few people go on to experience all of the symptoms of PTSD. And some of you may wonder, why is that? Why doesn't everyone go on to experience the full-blown PTSD?
And let's talk about the symptoms of PTSD, because many people might not know what they are. Exactly. So what are some common symptoms of PTSD?
Well, having a flashback or vivid memory of what happened, say in the car accident.
I think another one's hypervigilance, where you feel on edge. You're in a situation that reminds you of that previous trauma, and so then you're just like watching the room, checking the situation, things like that.
And another common symptom is to avoid anything that might trigger you to remember details about what happened.
And what kinds of experiences would you say cause PTSD or post-traumatic stress? What experience would a person go through to actually get PTSD?
You know, that is a really good question, because it's a common misconception that it has to be a traumatic experience. Like, some people think that you have to get your legs blown off in order to experience PTSD,
Right.
but it can be anything that causes trauma, and that differs from person to person.
Indeed, it does. And also there are long-term effects, like, for example, a child that grows up in a home where there's a lot of domestic violence. Those events that follow one after the other can result in post-traumatic stress disorder.
Yes, combat stress is just one. Domestic violence is one, for sure.
Sexual assault
Is another.
And here in Eastern North Carolina, there are a few people that I've seen who have experienced PTSD as the result of a natural disaster.
Yes, and what are some of the symptoms after a natural disaster that may, qualify someone for PTSD? We've mentioned some of those.
Some people will initially feel rather numb. They might dissociate. They might have a sense that what's happening isn't real. And then as time passes, they begin to feel as though they're not sleeping well. They may begin to avoid certain people or places. Folks might have somatic concerns, or they might feel physically unwell, and those can all be symptoms of having a PTSD experience with a natural disaster.
One myth is that if you just avoid it, and if you just don't think about it, then it'll just go away. Have you found that to be true?
Oh, absolutely.
Yeah.
Yes.
Yeah.
And that's where I've noticed a lot of people I've worked with, they have this anxiety, and how they feel better is they just avoid that situation altogether. They're like, I just won't ever go to that place again, or I won't ever go on an elevator again, or I won't be in that situation again. But then they find themselves isolated, so then they're not leaving their homes anymore, and they're depending on other people for security. So they're only living half a life because of avoiding all those things.
And another thing that can happen with the avoidance is it really gets into the emotional level. I mean, basically, it's anything, like, we sense our world through 5 senses. So anything can trigger that. We might think that we're avoiding it, but then something will come along that mimics that sense, that sensory input, which is locked in that emotional center, and it could trigger a panic attack, or it could trigger anxiety, and we might not even know why.
Right. I'm glad that you said that, because I think that, you know, in addition to a myth being that if you just ignore it, it'll go away, there's also some thinking around talk therapy being the way to help a person become more well. But the reality is that for a person that has had a traumatic experience, talk therapy just often doesn't go as deep as is needed, because people that have had a traumatic experience, especially children, that experience is actually stored in a part of your brain that maybe the conscious mind doesn't even have access to. So when you're talking about the amygdala, sometimes the amygdala is considered to be the smoke detector of the brain. So if you've had a traumatic experience, there's a strong possibility that has gotten stuck on, and so you're always sort of in a state of high alert. And so things other than talk therapy can support a person to get unstuck, and those things can be as simple as yoga, to be able to sort of retrain the body or the brain to be, that part of the brain to be more peaceful. Another one, of course, is EMDR, who Sherry has taught us a lot about.
Well, I'm glad that you mentioned the brain and where it gets stuck, as both of you have, because that's why talk therapy doesn't go as far as it can take you up to a certain point, but it stays in the mind. And as Lisa mentioned, as a child or an adult who was traumatized, you don't have access to that part of your brain is locked. And so things are in the reptilian, and so you're more activated almost all the time. And I had a client who was triggered by sheets. Some clients are triggered by smells. And so you just don't know what the trigger is going to be. The trigger can be the 4th of July fireworks, a parade.
It can be a song on the radio.
Can be a song on the radio. So that just tells you how that the brain can get stuck, and it won't be necessarily the talk that gets you unstuck, but that certainly is a great place to start.
Absolutely, and I was thinking too that a lot of times when we have a traumatic situation, sometimes our bodies go into this fight, flight, or freeze mode. And what that does is it draws all the resources from the outer cortex to that emotional center, the amygdala that you were talking about. And so these sensory inputs don't have a chance to get processed. Right. They don't get a language marker. They're not in the language center. So all the talk therapy in the world isn't going to access that. So things like EMDR and expressive arts and yoga and things like that can activate that emotional part of the brain is going to do a lot more good in reaching that and helping to process those emotions or those unprocessed emotions than cognitive therapy.
Ooh, that's really well said. Now, that's not to say that there isn't a lot of faulty thinking that it can accompany a person's traumatic experience, and certainly we can learn to look at things differently or think about things differently, and sometimes for children especially, being able to learn to tell the story a different way, so that they can still remember what happened to them, but it's not necessarily as frightening as it was when they before they learned to tell their story a different way. But all in all, the bottom line is, unless you access those memories at the level where they are in your brain, they are always probably going to be a part of you and potentially be triggered and potentially impact your life.
And I think that's why it's so good to think about therapy and talking to someone about this, so that you have an opportunity to heal and have in harmony both sides of your brain, the right and the left.
Well said.
So that you are living in the now, and that trauma doesn't impact you in the same way it did when you were a child or when you were a young soldier who was facing combat, or you think about tsunami or some of the school shootings, or even, it doesn't have to be that big. It can be something like, I'm afraid of needles, or and process that. It can be a fear of elevators. It can be any fear that we have, that facing it and looking at it in a different way and processing that and bringing to harmony and being able to live life in the now the way we want to.
When you think about the book, the Body Keeps the Score, it's so important for children especially, and perhaps adults too, to be able to recognize where they feel their traumatic experience, because for most people the body sense is, maybe I feel it in my chest, or maybe I feel it in my stomach. So people who can get in touch either through yoga or meditation with where, really get in touch with their body and know where they feel certain traumatic events, are then able to also sometimes remember what's called a feeder memory, or a memory of something that happened even before the traumatic event. So because these things can indeed be cumulative, and that's why making sure that you understand how stress affects your body, and learning to be mindful, so that my jaw feels kind of tight today, and I think that what I know about that is that that might be where I'm carrying my stress, and that might be somatically where I feel my trauma, and it's time to pay attention to that, and maybe get down on the floor and spend 5 minutes doing some deep breathing or doing some yoga. So just starting out, I think it's important just to learn those relaxation exercises. So when you talk about trauma and treating trauma, learning to relax, learning what your strengths are, identifying where you feel your trauma in your body, and then addressing that trauma by using one of those bilateral stimulation methods that are common in EMDR. Those are all ways to build up to taking a look at that trauma and sort of getting it out of that stuck place. And then the best part is replacing it with how you'd like to feel about that event. So I'd like to talk about hope for just a second and say, if you have had trauma, and if trauma is affecting your life, there is tremendous hope that can be accessed, dealt with, and replaced with a wonderful, the life that you want. It's just a matter of talking to someone and going through those steps.
Absolutely. I think the hope is there, and I encourage everyone to talk to someone who is trained in trauma work.
Well, thank you everybody thank you for joining us, and I think I encourage you to talk to somebody, get some help if you're experiencing any of these symptoms. Just like Lisa said, just like Sherry said, and Christy, there's definitely hope. You can get better. And please join us again. And as always, if you have any topics that you would like for us to cover, go ahead and leave them in the comments below. Thank you.